In this video, we are going to be working on neck stiffness and or neck pain. So oftentimes with people with neck stiffness, you probably already realize that your head is coming forward. Maybe you've tried some of those exercises to pull your head back on top of your shoulders. But really, I want you to think of the head as the tip of a pyramid, and so if you don't have a foundation below you that's working properly, your head is going to start to tip forward and all of these muscles are going to start to tighten. So instead of just working on changing that head position today, we are going to be working on the structure below your head to let the head just fall naturally on top. So we're going to be working on especially the hips so they pull you back and your head can just kind of relax on top and it's not compensating for those hips. So we're going to start in our trusty static back position. So bring your legs bent over a standard chair at 90 degrees and we're relaxing our back into the floor. So here we're really working on neutralizing our pelvis and our hips. And that's going to make a chain reaction all the way up into your shoulders and your head, and let your head relax. So if you find that your shoulders are really rounded forward and your head is coming up off the ground and you have to tilt your chin back to be able to touch your head to the floor, I want you to grab a towel and stick it behind your head, not your neck, your head, and almost feel like you have a double chin going on here. And it's going to stretch out those neck muscles without you having to tilt your head and strain your neck like this. Now you might find that as you lay here and relax into this position, your shoulders start to fall and your head starts to fall. So if you're using the towel, you might be able to start removing the towel or lessening the height as you go along. In a couple days, you might not need the towel at all. So if you do not need the towel, you can just spin this with your head and your shoulders relaxed onto the ground. So we are going to lay here for 5 minutes, focusing on our breathing. So I want you to feel like you're breathing in through your diaphragm, which is that muscle right below your rib cage. When you breathe in, your stomach expands. And when you breathe out, your stomach contracts and lowers. So just practice that. You can even put your hands on your stomach here. To feel that rise and fall. Now if you're familiar with diaphragmatic breathing, you can go ahead and relax your palms up, relaxing your shoulder position. Everything just wants to relax and be neutral in this position. So you might find that you have a slight arch in your lower back when you first lay down here. I want you to take note if you have an arch or if you feel like one hip is pressed more into the ground than another. And if that's the case, that's some rotation showing up in your body, which is going to make a chain reaction all the way up into that neck and affect how your neck is sitting on top of the peak there. So again, focusing on that breathing. You can also tune into your shoulders and feel if one shoulder is rounding up off the ground more than another. Or if you feel one shoulder blade into the ground more than another, again, that's some rotation showing up. When we're rotated, it's going to light up our muscles differently along our back, and that, again, is going to make a chain reaction to the neck. I might sound like a broken record here. So just do a full body scan, making sure you're not holding any tension. You're fully relaxing your body into the ground. I like to do those full body scans every minute or so to see if I'm still holding any tension. You'd be surprised, as
when you start to pay attention to that, you're going to realize where you're holding the tension and try to release it. Breathing really, really helps. It actually helps massage the muscles of your pelvic floor so your back can relax into this position. You can close your eyes and just take a little nap. Now I'm doing this for a minimum of 5 minutes. If you find that you're very rotated, if you feel one hip more into the ground, like quite a bit more into the ground, or if you feel like your back is really, really arched up, I want you to stay in this position a little bit longer and feel like that back and that hip starts to relax into the ground. We're only going to stay in this for about 1 more minute. This is how I start every morning. Even if I don't have neck pain, which I normally don't, I just love to start my morning with this position. Bring everything back to neutral. All right, do one final body scan. Note if you feel that your hips are more relaxed into the floor, if you feel like your back is relaxing into the floor, if you feel like everything's kind of neutraling out. Neutraling, I don't think that's a word, I just made it up, but we're going to coin it here. See if your shoulders are relaxed. Excellent.
So my friends, we took a little vacation away from our studio because we need something to hold on to that is sturdy here. So we're going to do gravity drop, where you step onto something. Now you can see I have a little step stool here. You can use a step ladder. You can even use a stair. Just make sure that you have something either in front of you to hold on to or on both sides. So if you only have one handle on your staircase, then don't do this on your stair. Find a step ladder because you're going to end up twisting. Okay, so making sure your feet are even hip width apart. We're going to walk our heels off of your, I'm going to just use step stool. You're going to hold on to that something in front of you. So I'm using the lip of a doorway here so I can actually hold on to this. You're going to drop your heels down. So you're going to feel kind of like a calf stretch in your calves. Now you want to make sure that your load-bearing joints are stacked here. So your ankles, knees, hips, and shoulders are still in alignment. So you're not sticking your butt out like this. You're not rolling your shoulders forward. You're not bailing your hips forward. And that's why we're holding on to something. So really thinking about keeping everything stacked, hips back over ankles, and then slightly engage your shoulder blades down and back so you get a little bit of a retraction here in your shoulder blades. So we're going to hold this for 3 minutes. I'm going to count some of the time that we've already been in this position as I was explaining it. So I want you to pay attention. See if you feel this in more on one side than another. So are you feeling it in your calves? If so, are you feeling it equally in both calves? Or is one calf stretching more, or one calf you don't feel anything? Same thing with your back. You might start to feel this a little bit in the muscles in your back. Are you feeling it all one-sided? Or are you feeling it both-sided? So here as well, we're also working on reducing rotation and getting our whole posterior chain stretched out, lengthened to reduce that rotation and let go of that forward head position. We're getting all of those load-bearing joints stacked on top of each other. So making sure that your feet are staying straight, slightly pigeon-toed, they're not starting to evert out.
Let's give it about another minute. Now some people do, their hands get a little bit tired in this position, so you might have to kind of go back and forth. Doesn't really matter where you're holding on to something as long as your shoulder blades are still down and back and you're not caving forward like this. Ooh, my feet are trying to evert. Means go duck-toed, duck-footed. All right, so let's go ahead and come out of that one. So if you didn't feel like you were even when you finished and you feel like one calf is stretched out a lot more than another, I want you to stay in this position until you feel even from right to left.
All right, this next one we're gonna do is called static wall. If you're familiar with yoga, you might recognize it as legs up the wall, but we're gonna do it a little bit more active. So I'm gonna show you this version and then I'm gonna go up to the wall. So all you're gonna be doing is laying down on your back with your legs straight up into, not the air, on the wall. You're gonna be pulling your toes back, flat, 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 still slightly pigeon-toed like you learned in that straight foot video. What you wanna be sure of is that your tailbone is still relaxed into the floor, so it's not kind of coming up like this. So if you need to scoot back from the wall to make that happen, that's totally fine. Your legs can be here with your ankles against the wall. So I'm going to show you the best way to get up to the wall. You scoot your butt into that wall and kind of do a little fan kick up here, legs straight up the wall. Now again, check, make sure that tailbone is relaxed into the floor. Now feel like you're pulling your toes back here. You can imagine if you had a tray of drinks, you want to hold up that tray with your feet. So we're not going like that, we're not going like that. It's nice and flat. All right, quads tight here. And we're going to hold this for 4 minutes. So it's going to be a lot of holds in this sequence today. But I am going to walk you through some other things to think about while we do this move. So again, making sure that your tailbone is relaxed into the ground, your tailbone's not arching up and your lower back pressing into the ground. So you might even feel like you have a slight arch in your lower back, and that's okay. Keeping those toes pulled down active or relaxing the shoulders here. Still focusing on our breathing. Pay attention if you feel one side is stretching more than another. So depending on you, you might be feeling this in a different place than your friend or your family member. I've had people feel this in their calves, in their hamstrings, in their quads, in their hips, in their feet, in their toes, in their shins, lots and lots of places. So I can't really give you where you should be feeling it because everybody is different. But again, tune into your breath here, keeping your shoulders relaxed. So sometimes when we activate our hips, our shoulders want to round forward if our hips aren't used to being activated properly. So we're going to hold this for 4 minutes. If you need to take breaks, that's totally fine. Keep those feet active, making sure they're not pronating and supinating. Just pulling them flat back. You might feel like your back starts to relax a little bit into this. So if you noted in the first exercise in static back that you had some rotation in your hip, you might feel like that's getting better now because the past 2 exercises we've been doing worked on getting rid of that rotation. So we're really working on linking up our ankles, knees, and hips in a loaded hip position, and a loaded pelvic position actually, not a hip position. So we're already halfway through. Excellent job. I know mine's starting to burn right now. Keep breathing. Keep those quads tight. Keep those knees pointed straight, those feet pointed straight. Just focus on that breathing. I know it can burn a lot for a lot of people.
You might find that you get some muscle twitches along your legs. That happens sometimes. Still focusing on that breathing. Don't let those feet get lazy. As you can see, my feet are wanting to get lazy. We got about a minute left. Quads might start to feel really tired. Might be feeling a lot in your calves. There's lots of places that you might be burning. Now, some of you might feel like this is super easy. I do not, but I love this exercise. It was the bane of my existence when I first started. Now it's so helpful. Last couple of seconds. All right, let's go ahead and relax off of it.
The next exercise we're going to do is called sitting floor. It's actually very similar to the static wall that we just did. We're just going to flip it on its butt. So you're going to stick your legs out in front of you, and I'm giving you the side view here, but in a second I'm going to put it up against the wall. So same leg position we just had, but now we're sitting on our butt and we're going to round our lower back. So we're going to roll our pelvis forward slightly so we get a slight arch in your lower back. You're going to really feel your hips engage here. So we actually have to engage our hip flexors here. Instead of just arching your back, I want you to think of those hip flexors doing some work. Then you're going to bring your shoulder blades down and back. So we have a nice S-curve on our spine. We're going to hold this position. So I have my butt all the way on the wall, but if you're not that flexible in your hamstrings, go ahead and scoot out a little bit, but still place that slight arch in your low back. So you might feel like your shoulders are kind of relaxed into the wall, but you're letting your pelvis tilt forward, still bringing those shoulder blades together. So we're going to hold this for 3 minutes. Now I already started the clock, so maybe you can hold it a little bit less. I like to place my palms up on my thighs here, still actively pulling those toes back. So note if this exercise feels different than the last one, because they're very, very similar, but we're changing our pelvic position. So now we're engaging our hips a little bit more. We're also changing where the load is on your body here. So now our spinal erectors, all of the muscles that go up our back, are having to work a little bit differently here because we're not laying on our back anymore. So you can actually feel that your back muscles start to really work. They're going to want to form to this S-curve position. So just make sure you're placing that slight arch in your low back and still slightly engaging your shoulder blades down and back. They're being pulled down and back towards your bum here. Don't forget to breathe. Good. Still thinking quads tight, pulling those toes back. Again, slightly pigeon toeing so we're not like this. Good. How long do we have left? We only have about a minute. That flew by, maybe because I was talking to you the whole time. Who knows? Good. It distracts me from the burn if I'm talking. That's why I got into this in the first place. So I can just talk you through it and you don't think about the burn. Making sure those quads stay tight. Just pay attention if you're feeling this differently. If you feel like one shoulder wants to round off the wall more, if you feel like one's hinged forward, just pay attention to those asymmetries. And then as you go throughout the program, note if they're changing for you. Because that's what we want. We want those asymmetries to change. How long do we got? 15 seconds. Very, very nice. Good. Pulling those shoulder blades down and back. Almost done here. All right, go ahead and relax off of that. So after those last two where I made you really stretch out your legs and challenge your pelvis, we're going to end it with a more relaxing passive exercise. So go ahead and lay down in the hook lying position. So on your back, feet flat on the floor.
Now we're actually going to bring our feet together. We're going to let our knees fall out into a frog-like position. I want you to make sure you hold your big toes together. So you're not relaxing your big toes. They actually have to be active and they're holding together here. So now we're just going to relaxing your shoulders in this position. Again, if you feel like you're rounded forward, use that towel. Never tilt your chin up into the sky so you can get your head to the floor. You want that almost double chin position. Now you might notice that your pelvis is starting to tilt a little bit forward and your lower back is starting to arch a little bit, and that is totally fine here. We're actually getting some lower back extension through this position. But we're also working again on taking out that rotation. So this whole sequence is really focused on changing that rotation because that's what's making the chain reaction and contributing to your neck stiffness and pain. Again, still holding those big toes. So you might find that you're feeling not just a stretch within your inner thighs, but actually a little bit of activation in there too, because we are being active with holding the whole inside of our feet together and not just letting everything relax. So when people tell me that this is really relaxing, I'm like, that's great, but I want it to be a little bit more active where you're holding the entire foot together. Now, if this isn't the first time that you've done this video, you can add a little bit of shoulder work into it. Now, if this is still your first time or you're at the beginning, go ahead and stay relaxed in this position. But if you want to add a little challenge, go ahead and interlace your hands in front of your chest here. Make sure those elbow pits are facing each other and your hand is closed. Now you're going to drop your arms behind you here. If you can touch the floor, now I just hit my bolster there. If you can touch the floor, go all the way down to the floor. If you can't, then that's fine. So I'm going to finish off showing this. You can relax if you want. We're just going to go back and forth here, and you'll feel kind of a stretch within your shoulders, within your back. You'll just go back and forth, touching the floor if you can, or if not, you're going to get more to the floor as you go.
So that was our sequence on neck pain. We really focused on reducing that rotation so your body isn't having to hang forward, your neck isn't having to jut out as much, because now we have a better grounded foundation. Our ankles, knees, hips, and shoulders are working better together and not rotating, so your head and your neck don't have to take on so much stiffness.